Simultaneously to that, we have seen the way in which the NHS Social Care Act of 2012 came in, actually abolished the government's overall responsibility for providing healthcare to all of the citizens of Britain, and instead farmed it out to a quango. That quango, NHS England, is headed by Sir Simon Stevens, himself a sign of the insurance industry. And the majority of the funding for the NHS was farmed out to GPs, these clinical commissioning groups, who then essentially have the job of rationing care locally. And because they can't plan adequately, they brought a large number of private consulting firms in to manage that. And increasingly now we're seeing the merger and takeover essentially of the planning and governance and provision of care by large health insurance industry, particularly with the Centene, who recently bought out AT Medics, for example, but it's not the only example. Virgin, we've said for a long time, Richard Branson is the country's biggest GP, having over 3 million GP patients, is also started to take over hospitals. And there are many, companies who are involved in this process of bidding for and taking over NHS contracts, increasing the amount of private profit which is drawn out and decreasing overall the amount of funds which are left for frontline care.